Good morning, Paterson. Just returned from the annual City Lab conference in Mexico City hosted by Bloomberg Philanthropies, where over 100 mayors had an opportunity to discuss ways that they can improve their cities. Paterson was featured for the work that we're doing with Real Fix, and to date we've gotten 450 people to treatment for drug addiction in the city of Paterson as a part of this program, and we were showcased yesterday at the conference. While I was there, I met the mayor of Flint, Michigan. And I'm sure when you hear the word Flint, you think lead. And you think what happened 10 years ago, right, Dr. Paul? Where about 1 million people were actually impacted by the fact that contaminants were leaching into these old lead pipes, and it created a very unfortunate situation for the residents of Flint and made all the wrong national headlines. Well, we're using Flint as a cautionary tale. It's a lesson on what we need to do as a municipality to keep our residents safe. So I'm profoundly grateful to the Department of Health and Human Services, specifically Division of Health. We're always actively pursuing opportunities to find funding for lead abatement. And Dr. Paul, I'm proud of you and your team. We're gonna knock the lead out. We're known for our efforts to make sure that people are safe, and especially people who have been living in homes that were built before 1978. In the past, Director, we're accustomed to, $3 million in funding for our lead abatement efforts. Today, we're proud to announce we've more than doubled, and now we're at $7.1 million, the largest grant award to date. I don't know why anybody is not applauding behind me. What happened here? You don't have your breakfast there? They didn't get the memo.
Cold, it's cold.
No, it's not. It just came from, well, Mexico is the same. And this lead abatement grant for $7.1 million will help us get to 120 housing units. We are going to prioritize units with 6-year-olds or under because they are susceptible. They're at risk. And like I said, we've learned lessons from Flint, Michigan. So at this time, I want to hear from Dr. Paul Prasad, who in the past, of course, has led this Knock the Lead Out initiative. Dr. Paul Prasad, our public health officer. There you go.
Thank you very much, Mayor. Under your leadership as mayor, the Division of Health has been motivated and to go after these bigger funding. Obviously, because we know we can count with their help and appreciation. Bigger the funding, bigger the responsibility, yes. Bigger the undertaking, and the Paterson Division of Health is up to the task. Behind me is part of our lead team, our environmental health team. Give them a big round of applause. We started a Knock Out the Lead program about 6 years ago. And at that time, we had no funding to do abatement. So that was the missing ingredient in our recipes, to use an analogy. We applied for funding. It was a big task because we did not have the experience in doing this, but nevertheless we applied. We were encouraged to apply by grantors that gave us a small amount of money, like $25,000, $30,000. Said, look, you guys, based on what we see here, you guys would do really, really well, and you should apply for the HUD funding. We took up the challenge and we applied, and we were awarded $3.3 million, to the vicinity of $3.3 million for both lead abatement, remediation, and also healthy homes. In the beginning, it was very challenging because as a city, we have to follow the government process of bidding and allocation of contracts, and that delayed us for a number of months. But we achieved that, and we went along with our program. before, around just about the mid part of our program, we had a site visit, an inspection by the federal government. And when the federal government came here, they found that we've been doing really well despite the setbacks we had earlier. And they encouraged us at that site visit to apply for funding for the, whenever the grant ended. And we did that, and lo and behold, they actually doubled our funding. They more than doubled our funding. And that's a testament to this team that I have behind me here, to our director who has been very, very cooperative since he became the director of the Division of Health, I must say that. And also our mayor, as I mentioned earlier, he's been with us every step of the way. And you need the backing of an administration to achieve these type of complex projects. This is not easy. It's not easy to get a unit to be abated because it requires documentation from the occupants and a number of challenges. And we have done well. We've reached our goals, and HUD is very, very happy, and that's why we're being awarded. So once more, I want to thank my team and the administration for the city of Paterson to allow this to actually happen. Thank you very much.
And Dr. Paul, again, I want to commend you on your leadership. I just had a flashback back thinking about 2020 and 2021 when we had contact tracers here, and we were nationally recognized for the work that was being done in Paterson to save lives. And then, of course, our vaccination effort was hailed as a exemplary model in the state of New Jersey and in the United States of America. So thanks. It looks like our Division of Health is always up for the challenge. Thank you. That's why we paved your parking lot. I wanted to get, you're welcome. We didn't have a press conference for that, so I forgot. At this time, I want to call forward our Director of Health and Human Services, Joel D. Ramirez.
Thank you, Mayor. Thank you for not staying in Mexico and making this today.
You're welcome.
Thank you for the press who's joined us today. Today, I just want to extend my heartfelt gratitude to our team behind me, and I know there are some people that are part of the team that are not here. Because of the great work they have done, we've managed to get this award and to increase the previous award that we received. It is because of their high quality work that now this will be a testament to that. And I am just more than proud to be the department head for the Department of Health and Human Services. I have to thank Dr. Prasad because, in case you guys don't know, he is your biggest cheerleader. He is your biggest advocate. He is always asking for the tools that this division needs in order to be successful, in order to offer Pattersonians everything that they deserve. So this grant is just going to get us closer to truthfully knocking out the lead in all homes, making Paterson a healthier place for the generations to come. And I want to thank the team behind me and those that are not here, from the inspectors to the investigators to the health educators to the nurses. Each and every one of you has a very important role in making sure that children in Paterson live long, healthy lives, and it begins with making sure they don't get lead poisoned and it doesn't affect them in other ways. So thank you very much. Thank you, Mayor, again.
Thank you, Director. Thank you. And just going to take you back to 2018 when I ran that time successfully for mayor. One promise I made was to hire a grant writer because the city didn't have a grant writer on staff, and we have Millennium Strategies. And 6 years later, we have almost $65 million in grants that we're able to secure. And we are very encouraged by the fact that those grants, a number of them, are public health related, because now we're talking about life or death. And now we're talking about keeping our families here in Paterson safe, especially a focus on our children. So I think getting the grant writer was one of the best decisions that we could have ever made, because what does it result in? The fact that we can serve our residents and ultimately make sure that our residents are safe. Thank you for joining us. Oh, and I forgot to say, we also did some interior improvements as well to reward you for your hard work. Thank you very much, everybody. The new and improved.